Welcome back to another episode of the weekly NFL Injury Report. I'm your host, Lil Jon, not the rapper, just the PT. But today we're going to be breaking down some quarterbacks, receivers, and running backs around the NFL that are popping up on the injury report. Some that aren't as serious, some that may be out for a little while that may affect your fantasy teams, and then a deeper dive into what it means to dislocate your ankle and what Chris Godwin may be going through in his recovery process. So without further ado, let's get into it. Starting off first, America's team, which I don't fully believe anymore, but Dak Prescott, the quarterback for the Dallas Cowboys, left the game with a hamstring injury last week. He is expected to go on IR. Reportedly, he not only strained his hamstring, but partially avulsed it off of its origin site higher up on the pelvis. And what that avulsion means is some of that tendon has actually come off of the bone. So he's expected to go on IR. They are unsure how long he's going to be out for, but at the very least, he'll be out 4 weeks in that short-term IR. Typically, we talked about this a little bit last week with Mike Evans' hamstring injury, where we took a deeper dive. That grade 1 to grade 2 is you're looking somewhere between 4 and 6 weeks, possibly a little bit longer in a grade 2 case. With that partial tear coming off the bone, because that tendon doesn't have as much blood supply, he's expected to have a much longer timetable for recovery and getting back onto the field. Baker Mayfield, one of my favorite quarterbacks to watch, awesome story. Popped up on the injury report with a toe injury, but he is expected to play. He has been absolutely crushing it this season, playing phenomenally well, even without Godwin and Evans last week. So make sure you keep him in your lineups. Moving over to the receivers, another Dallas Cowboy, CeeDee Lamb, this time the receiver, their star receiver, I might add, is currently listed on the injury report with a AC injury or acromioclavicular injury. And that AC joint is up here on the top of your shoulder where your clavicle runs in and meets your acromion process, which is a protrusion off of your scapula. That joint is really, really important for shoulder motion, especially getting your arm overhead, which is very important when you're doing most things, especially playing football. He is expected to play, but it's something to keep an eye on, as usually that injury can be pretty painful and easily aggravated in a football type of play style where you're getting contacted, you're being tackled, and then also he has to get his arms up to catch the ball. So that's definitely something to keep an eye on, and we'll actually dive a little bit more into AC injuries and what that means next week. In other receiver news, going to the opposite, but staying in the NFC East, both Devontae Smith and A.J. Brown popped up on the injury report this week for the Philadelphia Eagles. Brown left last week's game with a knee injury. He had an MRI. Reportedly, it's not that serious, and he practiced in a limited fashion on Wednesday. That's something to keep an eye on, but it definitely sounds like he's trending in the right direction, and he will be playing this Sunday. Devontae Smith, however, popped up with a hamstring injury, which seems to be the common trend recently. He did not practice on Wednesday, and it's definitely someone to keep an eye on moving forward. Obviously, with Brown playing, and if Smith is not able to go, Brown will see a lot more targets and they'll spread the offense around a little bit more. But Smith could be a huge loss to the Eagles as they actually play Dallas this week. Moving on to the running backs. Isaiah Pacheco, a name that we have not heard in a little while. He fractured his fibula earlier this year, I believe in week 2. He's been on IR ever since. He is expected to be activated in 2 to 3 weeks, as well as begin practicing within that time frame, which would be a huge return for the Chiefs, although Kareem Hunt has been playing very, very well in Pacheco's stead. So we should see him back fairly soon. It sounds like he has not had any regressions or setbacks in his recovery. We are finally going to see Christian McCaffrey play football this season. I'm calling it right now. He has officially been activated off of IR. He has been practicing, still in a limited fashion, but he reportedly has no pain, according to my sources. My sources is Kyle Shanahan, who literally said it in an interview. Whether that's true or not remains to be seen, but it's definitely exciting for all fans of football, especially fantasy owners that have him on their team, may have taken them first overall with that top pick. In other words, my fiance Maggie, but we're not saying names here. Also, especially for the 49ers as they get their star dual threat running back. It should be fun to watch, but something to pay attention to. With some of that Achilles tendonitis and calf strain, what can end up happening is when there's this long-term inflammation surrounding the tendon, and then injury to the tendon itself, it becomes much easier for a greater injury to occur if it is left untreated or if it's rushed back too soon. My hunch is that that's why McCaffrey is taking so long to get back to practicing and possibly playing this season. If you remember in last year's Super Bowl, Dre Greenlaw, in a horrible incident, was running onto the field, stopped, and then tried running again, and he tore his Achilles. He ruptured that tendon. I'm sure that's probably still in the forefront of 49ers fans and coaching staff and team-wise minds. That is my hunch as to why McCaffrey has taken so long to get back onto the field. It's because they're trying to take their time and reduce the likelihood that any further injury occurs. Let's get into the deep dive for this week, which is Chris Godwin. A couple of weeks ago, he dislocated his ankle, and if you happen to watch the game and see the play, it looked particularly disturbing. He was essentially laying on his stomach, and his foot was pointing in a direction that anatomically and mechanically it should not have been pointing in when he was laying on his stomach. Looking at it, they said that he had an ankle dislocation that required surgery. Now, with an ankle dislocation, it can mean a couple of different things. Typically, they fall into one of two categories, where the dislocation occurs without a fracture, and then where there is a fracture dislocation, which unfortunately is the majority of injuries. There's more often a fracture than there is not. The most common way an ankle dislocation occurs is by having your foot plantar flex, so pointing straight down. It's planted on the ground. You have what we call an axial load, which is where you are delivering weight or a load through the long axis of the bone, and you then are forcibly inverting your foot, so turning that foot and ankle in. Your ankle is actually made up of several joints, 3 to be specific, but the joint that it most often occurs in is your talocrural joint, which is where your tibia comes down and meets your talus. And that talus ends up dislocated, could possibly be in any direction. The most common, however, is posterior medial, which means just back and in. Depending on the way that the talus dislocates, there can be instances of different types of fractures, or some fractures that are a little bit more severe than others or take a little bit longer time to heal. The most common fractures that occur are what we call either bimalleolar or trimalleolar. Now, your malleoli, and I brought this great big book of everything with me. If you've been to the clinic, you know that this is one of our favorite things to use. So, if we're looking at the tibia and the fibula itself, your shin bone's running down. At the very bottom here, this is where the talus would then come in contact with the tibia to form that talocrural joint of your ankle, where we get our plantar flexion and dorsiflexion from. These two bony landmarks on the outside here are what we call the malleoli. Okay, you can feel them if you palpate and touch the outsides of your ankles. You feel these two pretty large knobs on either side, one on the inside, one on the outside. These are the two areas that typically get fractured in both the bimalleolar and the trimalleolar. That's why we call them two malleoli, bi. What we look at, right, is when that ankle dislocates, that talus then moves into some of that malleoli and fractures it. Now, for a bimalleolar, both sides fracture. Okay, both the outside here, the lateral, and the inside, the medial. With a trimalleolar, these two still fracture, but the furthest back part, or in anatomical terms, distal posterior aspect of the tibia, also fracture. And that's what a trimalleolar fracture is. And if we look at the anatomy of the ankle joint itself, this is what we see. So, looking at the actual foot and ankle, you can imagine the tibia comes down over top of this. This bone right here is that talus. And that is what ends up dislocating more often than not. This is looking at it from the outside of your foot. This is from the inside aspect. It's going to move down and back this way more often than not. So typically with a fracture, there's usually some type of ligamentous injury as well. With the other category that we talked about, that's much less common, where there's a dislocation without a fracture. Usually there's some type of ligamentous injury, not always, but more often than not. And what we see in that ankle is you have several different components that are designed to try and give some stability to that ankle. And the more common ones are what we're going to talk about today. So on the outside of your ankle, we have three main ligaments that we think about. You have your anterior talofibular ligament, which is right here, your calcaneofibular ligament, which is running right through here, and then your posterior talofibular, which is this one right here. When you sprain your ankle, the one that's most commonly sprained is this anterior talofibular. These ligaments on the outside, they have multiple different jobs, but together they all work to prevent your ankle from turning in too far. That inversion, which we talked about, is one of the more common mechanisms of injury for an ankle dislocation. It's also the most common mechanism of injury for an ankle sprain as well. On the inside, you have this really thick group of ligaments right here called the deltoid ligament. That is what prevents your ankle from going too far out. And the other thing, aside from the ligaments that provide some of that stability, are the malleoli themselves, right? So what happens is if you go too far past the ligaments, those ligaments can rupture, and then you end up fracturing as well. There's also been cases where the ligaments are actually a little bit stronger, and you still get that full range of motion without fully tearing those ligaments, and you still end up with a fracture. So that's kind of the anatomy behind it. That's what's occurring in the joint itself. What does that mean for Godwin? Well, they did say that he is having surgery. So it's more likely than not that there is some type of fracture in his ankle, whether it's bimalleolar or tri, that remains to be seen. But what they will try to do with surgery is essentially give him some stability. So they're going to reduce the articular surface that has been dislocated, right? By reduce, meaning like they're going to bring that joint and the bone that's been dislocated, more often than not the talus, back into its anatomical position. They're also going to try and restore the fibular length, and then they're going to fixate the joint with a rigid fixation. Now, depending on the severity of the injury, they may have to do different types of fixation, which can lead to increased likelihood of different complications such as infection and things of that nature. But once he has the surgery, depending on, again, the severity of it, what he actually fractured, what ligaments were injured, he's going to have to more than likely be on crutches or some type of walking boot. Depends on the surgeon themselves and what their protocol is. But generally, he'll be in a boot for a good amount of time, reducing the weight and load that's being put through that foot and that joint, as for the first probably 6 to 7 weeks at least, he'll be just doing things of just general range of motion, some ankle pumps, things of that nature to try and prevent any other complications that might affect his circulation. He can do some exercises that do not involve the ankle but continue to work other muscle groups, such as single leg raises or sideline leg raises, working through some of that hip musculature crossing the knee, but not doing anything specifically targeting the ankle joint yet. Then after that 6 to 7 week mark, you can start to do a little bit more manual therapy, working on getting some of that swelling out, which you'll also be doing in the first 6 weeks, and continuing to progress him forward as he begins to bear more weight through that joint, that foot and that ankle, as he starts to return to sport, working through some of those similar stages that we talked about last week with Mike Evans, where first he has to bear weight on it, and then he has to start walking without the boot, walking longer distances. He'll be increasing his time and duration, intensity of being out of the boot, and then working through strengthening and correcting the stabilization in that joint, and ultimately trying to get back onto the field. It is highly unlikely, near impossible, that he will be back this season. It would have to be one heck of a deep playoff run to even consider it, and at that point it's still really, really unlikely. But this is definitely something that he can come back from and still be the same player that he was before. It's going to take a lot of time, it's going to take a lot of effort, but it is doable. He's come back from multiple ACL tears, and he was having one heck of a season, so it's unfortunate to see him go down, but I have no doubt that he will be a fantastic player moving forward. That is all we have for this episode. I appreciate you guys tuning in, and as always, commenting, subscribing, and clicking that bell. Next week, like I said, we're going to explore the AC joint injury a little bit, talking about CeeDee Lamb and how that AC joint fits into that shoulder complex and why it's so important. So make sure you tune in next week, and I'll catch you in the next one.